Welcome back to Dolor Factor Live. Time is just going by really quickly, and we're having this discussion. At one end, I want us to continue so that we understand what happens, but at the same time, I do want you to understand and to be able to answer some of these questions because they are pivotal. It's something that you do need to know. So, Doctor, I'm actually going to hand it over to you because I think that you're better placed.
So we had given the example of a patient with a breast lump, and on the other hand, I can give the example of a person who may be going in for a routine screening. Say you have an elderly gentleman, maybe 50 years and over, who goes in for a routine screening and he sees his GP. And the GP suggests to him, well, you know, there's some tests that are recommended for somebody of your age. And well, why don't you can get your prostate checked. You can get your colon checked as well. And to do that, for instance, to screen for the colon, there are a number of tests that are done. However, the recommendation for a person 50 years and over would be that the person gets a colonoscopy done. And at that point, the GP then refers the patient to a person performing a colonoscopy. Like that could be a surgeon. For instance, in this case, might be Dr. Titus or Dr. Kabiye Daniel, Dr. Burt, and certain other gentlemen in St. Lucia. He goes on to there, and the surgeon then performs this test. And once this test is performed, you know, there are a number of things that that entail, and I think Dr. Titus might be able to give us some more details where that is concerned.
Yes. The process of screening and doing a colonoscopy, as Dr. Gabriel stated, screening is a test where we're looking for something where you don't have any symptoms. So the colonoscopy is a way to look for early signs of colon cancer or early colon cancer where we can do something about it before it becomes advanced. And the procedure takes about 15 to 20 minutes. I routinely do it with assistance of an anesthesiologist that gives a medication that puts the patient in a gentle sleep for me to do the procedure comfortably. Once I'm there, if I find any small growths or polyps, I can remove them. Or if I find something large, I can take a biopsy. I will then send that tissue to the pathologist who looks at it under the microscope and tells us if there's cancer or not. Based on those findings, for instance, if someone then has a cancer, I can then take that patient to surgery to remove that segment of the colon that has the cancer in it. Once that patient is through, then we refer the patient to the oncologist, like Dr. Gabriel, for any further treatment for the cancer, like chemotherapy, or the patient may require radiation therapy, which is then sent to a specialist that gives radiation for that disease process. And so it's a multidisciplinary approach to the patient care, and it all starts with a screening test, like a colonoscopy, that can find something early where we can do something to save a life.
So who would decide then what the best course of treatment would be?
We doctors, we have conversation with each other. There are various ways to do that. Where I'm from, in St. Croix, we have what's called a tumor board, which involves surgeons, oncologists, radiologists, pathologists, radiation oncologists. We all discuss cancers and patients that have cancers of certain types, and we come up with a consensus of how to treat that patient, and then we take that back to the grassroots, dealing with the patient on an everyday level until that patient is treated and cured.
Okay, so when you say we do that, is it something that you do, everyone sitting around a table and you have all your patients and you discuss them?
Exactly.
Or is it just as it comes, someone calls you and then?
We meet every 2 weeks, and we discuss 8 cases, over that period of time. And so we all sit, we present the patient, we all discuss what's the standard of care for that patient, and then we come up with a plan of care for that patient, and we all then take that information and we deal with our patients appropriately.
Okay, now I know that internationally, I know in England, the doctors there, they tend to try to avoid surgery. They try to do all kinds of things before you get to surgery, unless it is one of those emergency cases. Now, that's the way I knew it over there. Is this the way it is practiced internationally in terms of you try your best not to get a patient into surgery?
No, surgery is a proven therapy modality. And it's not always, when we do have to do surgery on an emergency basis, it's usually a very late stage of that disease process. For instance, someone can have an operation to have their gallbladder removed, before it becomes a problem down the road. So, or a hernia fix. These are surgical therapies for things that you typically cannot treat medically. So not everything is treated medically with a pill or with radiation. It has to have a surgical modality to treat it. And many cancers fit into that spectrum. You can shrink a tumor or shrink a cancer down with chemotherapy or radiation, but most cancers will require surgery to remove the bulk of the tumor so that chemotherapy and radiation can be effective in wiping it out altogether.
Okay.
And I have to add that, you know, the decisions as far as what is done is not an arbitrary decision. A doctor has been trained over a long period of time to look at all the condition, the circumstances, and there's evidence that says, well, if these circumstances exist, this is the method of treatment or the modality of treatment at that point in time. So the decision to have the surgery is really based on something scientific and well tested. And that's why we think that the modern medicine is a medicine that is based on teamwork. And I say teamwork in a very wholesome sense. Teamwork doesn't just mean that several people are working together. For it to be effective, it must mean that there must be systems in place to facilitate that teamwork. And the tumor board is a very good example of this, where people come together because they know that coming together improves the patient outcome. Not just, you know, because you can talk to somebody on the phone. It's because you have decided that there should be consensus in the way forward in the management of this patient.
Okay, I mean, so far we've spoken about the way it should be. Now, why is it in St. Lucia there are so many stories, we hear so many stories of things going wrong or delays? I'm waiting for my results, it's taking so long, why do I have to see this person, why do I have to see that person? People being misdiagnosed, having to do several tests before the condition is found out. Why does this happen? If there's supposed to be a team, why is there a lot of back and forth? And it's a very common thing that we hear in St. Lucia. I don't know if it's the same in St. Croix, but we have that a lot, where patients feel there's too many tests before we get to the real thing.
But you mentioned St. Lucia, and I think there's no perfect system anywhere. Certainly there are shortfalls in what is being done here. What we want to do is to improve on the current conditions and maybe assist with making diagnosis more efficient and more, readily available to patients. It's work in progress. Now we have embarked on transitioning into a new hospital system, and I mean, for me, it's not just transferring personnel and equipment to a new place. I think it needs to be putting together systems of teamwork, and this is not just among doctors, but it's among departments of the radiology department, the laboratory, the rehabilitation, physiotherapy, the maintenance. Everybody has a role to play, and we have to see how we can join our efforts within each specialization. And eventually, all of these delays and all of these problems that we've mentioned will eventually phase out. But it won't happen immediately. It will take some time.
So whose role is that? Whose role is that to ensure that when there is a decision to be made, or when, certain things have to be done, that who can look at this case and say, why is this taking so long? Why are the results not ready yet? Or is there anyone who has is it the person, the head of the hospital, or is it the head of the department, or who's overseeing all this?
I think it falls on the shoulders of both the doctors and the patient. And you have to remember that resources or lack of resources is responsible for many of these delays that we talk about. If you have only one pathologist on your island and all the specimens from around the island comes to this one pathologist to look at it under a slide and give a diagnosis based on what he sees from the biopsy, it may take 2 or 3 weeks to get a result. If you have 4 or 5 pathologists doing that job, you may get results sooner. If you only have one CAT scanner on the island and you have 100 people waiting for a CAT scan, it delays the ability to get that diagnosis. So resources are at the forefront of many reasons for why we can't get diagnosis early. Again, communication amongst physicians. In where I'm from, we have electronic medical records is almost mandatory in every physician's office. So we're able to share information amongst physicians. And so if you see your doctor, I can access your records very easily, so they help me to make my diagnosis. I think that is not something that's standard here in St. Lucia, and I believe it may be coming, but for now, those are things that compound why things move along in a slow fashion as the public sees it. Yeah.
Well, I'm very worried about what you've just said, because I know that in some instances there are just one or two specialists on island, and if those delays are being caused, then it means that sometimes patients are not making it because we haven't got enough of that speciality on our island, and that's very concerning. Where do we take that? Perhaps the Ministry of Education, not education, the Ministry of Health. Where do we take that? That's a grave concern. All right, well, we have to go to a break now, unfortunately, but when we come back, we're going to open the telephone lines in case you have any comments or questions that you'd like to ask our doctors. So this is Dolor Factor Live. We'll be back shortly.